Hello, my name is Annalie Martin, and today I will be going over how to administer enemas. So the first one I'm going to go over is the small volume enema, and for that you are going to want to make sure that you have privacy in the patient's room whenever you're going to be exposing them, like they're like any part of their body. You're going to want to make sure that, especially their their private area, you're going to want to make sure that you give them the privacy and that you close the door, close the curtain if that's what you're using. That is very important. You're going to want to keep that bath blanket on top of them, and this is what I'm going to use as my pretend small volume enema, which is also I did forget to say it's going to be a hypertonic solution. And it is also sometimes referred to as a fleet enema. That is one type that they use. So you're going to remove the cap on the enema. You're going to lubricate it 2 to 3 inches. And then you will, of course, explain to the patient what you're doing. And you will only expose that area. And for this, you will want the patient in the Sims position with their one leg kind of bent up so that you can get a good view to be able to see what you're doing. So you will want to use the enema. You're going to want to insert that 2 to 3 inches, and you will start to lightly squeeze, and then you will fold the enema up so that the rest of that can go in there. You are also going to and then you're gonna tell the patient to wait until they have to go to the bathroom, and then if they need you to, you may need to have a bedpan nearby. Sometimes even if the patient is unable to go by themselves, if they say they are, and you look at their chart and you realize that they're really not able to, you want to have that bedpan handy just in case. You never know if they're gonna have to go right away and not be able to make it, so you want to make sure to have that handy. If they can go to the bathroom, you'll want to make sure that that you assist them with that as needed, and then that way you'll be able to get, if you need to get your specimen, you'll be able to do that. You'll want to make sure that that the sample does go into the container. Then you're also going to want to document your procedure, making sure to check with the patient if they have any nausea or if they have clammy skin or diaphoresis. You're definitely going to want to check that. You're going to want to document the color of the stool, how much. You're going to want to make sure to document as well. And I did forget to add that when they are waiting, you're going to want to make sure to lay them back on their back, because that will be the most comfortable way for the patient to lay. So the next one is going to be the large volume enema. So that is going to be your hypotonic solution. So that could be tap water. Sometimes they also have a soap suds enema. They have the normal saline solution enema and the oil retention enema. So with this, you are going to want to make sure that you wash your hands, and of course check the patient's ID band. You are going to want to with the IV, you're going to want to mix the solution into the tap water if that's what you're using. That was the example that they used in our video. So you're going to want to add the additives. In the video they used sodium, so that was the example that I used. So you're going to want to add that in to the bag, and then to prime the tube, you're going to want to hang it on the pole, and then you are going to want to unclamp the tube and let the solution run in until the air is removed. And then you're going to want to reclamp the cap. So you're going to want the bed at level, and again you're going to want your patient in the side lying Sims. It really will be the Sims position, because so you'll want to have them lay on their side, grab the side rail and lay on their side, and you're going to want that bed at the right level, and you're going to want to stick a pad. I'm using an Amazon bag, so you're going to want to make sure that you have that pad underneath. I mean, really, you're going to want to have the pad in any situation like this, just in case, because you wouldn't want that mess to you know, be on the patient, because that would be very uncomfortable. You are going to want to have the bedpan nearby, and you are going to lubricate the end of the rectal tube. So it's going to be the same as the other, as the small volume enema. You're going to want to ask your patient to take deep breaths, and after lubricating 2 to 3 inches, you'll want to keep the patient covered until you're going to want to lubricate the tip of the rectal tube, and then you will remove the covering, and you will insert slowly as you're telling the patient to take. Usually the video said to tell them to, and the book said tell your patient to take several deep breaths, and then you're going to want to insert it about 3 to 4 inches, and you're going to again want to angle it towards the umbilicus, and then you will use a clamp to release small amounts at a time, and then clamp the tubing, and then you will remove the tube. Okay.